Well, from the hard politics and the commentary, let's talk health. Now, residents in Jantuakrom, health workers as well, in that farming community and the Amenfi central area of the Western region, are happy about how Zipline drones are positively impacting healthcare in that area. Now, according to them, Zipline has added on to their lives, so to speak. It has made healthcare better in that community. My own colleague Samuel Kojo-Brace had an interaction, and we'll be sharing that with you shortly about how we can consolidate these gains that have been made in the health sector. But first, let me introduce the guests who will be joining me right before we get into what Zipline drones have on offer. Dr. Fred Adomako-Boateng is Bono East Director of Health. A very good morning to you, Doc. Doc, you would have to unmute.
Sorry, good morning.
It's really good to have you. I get excited each time I have you. I don't know why, but it must be what you add to the conversation. So thank you so much for making the time once more. We also have Dr. Osei Kufuor-Afre. He'll be joining the conversation. He is the Regional Director of Health for the Oti region. So Bono East Director of Health and the Regional Director of Health for the Oti region. But for now, gentlemen, Samuel Kojo-Brace's package on Zipline drones in Jantuakrom.
This is Jantuakrom, a farming community, 3 hours drive from Asankragua, the municipal capital of the Amenfi West municipality of the Western region. This remote village is home to a tight-knit community of people who farm for a living. Their community is unfortunately connected by a terrible road network. The community has a chips compound, which serves as the main source of healthcare for the people here and the many others surrounding this community. However, the chips compound is plagued by several challenges. Ben Mieza is in charge of the Jantuakrom chips compound.
Very challenging, but we are managing. Yes, very challenging. There is no light, and the staff do not have quarters for accommodation. So we are just managing, but it's challenging. Where we stay, we do not have permanent accommodation, so we use some of the facility as staff accommodation. And during that, we can't have space for both male and female when we are to detain people. For instance, somebody coming to labor and you need a space. A male too is occupying that same ward. It's either you discharge the male to go home or to refer and attend to the delivery, or you let the delivery go ahead. It might be that the person might deliver on the way, and it's very bad. So we are just seeking that if it will be possible to get anybody to come and help us to have accommodation for staff, it will be very good for us.
Lack of electricity affects them badly because they are unable to store vaccines and other critical medicines.
We are supposed to vaccinate children every month. We have to move to the nearest community, that's Odankotoms for vaccine. Come and use them. After that, you have to send it back, which also affects us. If in transport, there can be anything. If there is vaccine here, we use it and keep it. But because we don't have a vaccine fridge and light, you have to go and put the vaccine in the light. You can get accident on the way, and that is a fact. If we're having our own light, we're getting a fridge and we're putting our vaccines here. Even in some of the things that we use, especially oxytocin, they are supposed to be in a cold pack. We don't have light here, so there's no fridge for you to keep the oxy, and it's also a problem. So if you have light, so many things can be done, and health delivery will be very smooth for all of us.
The chips compound, due to the distant nature of the community, had been battling with the difficulty in transporting their medical supplies, such as vaccines, to the facility. But today, with the drone services provided by Zipline, medical supplies including vaccines are supplied directly to the chips compound, bypassing the poor road infrastructure that otherwise made it difficult to transport medical supplies.
As for that one, by God's grace, we have been enlisted on it. So our vaccines that we talk about, is the drone that brings to us some drugs. If we get shortage of drugs, we request and they bring it. So as for that one, incidentally and by God's grace and our municipal director, the health director and other people, by their help, we've been able to get that thing. So that for that one, we thank them for that. But we are just seeking that they help us with the light, because as for that one, it is affecting us.
The SHIPS compound is faced with a lot of challenges, from inadequate rooms to cater for patients to not well structured maternity delivery bed. But there's a spark of hope here. It's because the drone services by Zipline has been serving this community adequately. The in charge is excited by this. Ben Mieza took me through how the drones deliver product to them.
So just in front of the facility, there is a space there. So they came for a survey and they saw that there are no trees there. The place is very plain. So when we request about in 30 minutes, 40 minutes, the drone will just come, and when it gets here, it gets down a little, open up, and the thing falls. We pick it, no damages. And as for that, we are grateful to whoever who brought it. Yes, it brings from vaccines to medication to family planning commodities. Anything that we need that they can provide, they bring it. Yes.
According to him, the drone services have helped them solve their essential needs.
Sometimes you put them in your vaccine carrier on the motorbike. As you are coming, some of the vaccine will get broken. Sometimes the paper on it that contains the batch numbers, they get deleted. And by the time you get here, you are frustrated. But for this, and sometimes you have to spend time. By the time you come, the people have come to queue up, and it's very bad because if somebody comes, the person keeps long, the person will not come back again, irrespective of the things that you tell the person. But for the drones, you just type it, papa, Jantuakrom chips, we need this. Within the next 30 minutes, the drone will be here. It forces you pick everything, no breakages, everything is there, and it is very convenient. So as for that one day, we cannot compromise on that.
A recent study by ID Insight, an advisory, data analytics and research organization with funding from the Bill and Melinda Gates Foundation, reviewed drone services decreased the number of days that facilities were without critical medical supplies by 21%. It shortened vaccine stock out by 60% and decreased people being turned down for vaccinations due to issues with inventory by 42%. Zipline's service also increased the types of medicines and supplies that were stocked at health facilities by 10%. So how many times do drones deliver services to Jantuakrom?
As many as you can, as many as you request, they come. As many, even a day. Sometimes you'll be doing CWC weighing, and you are short of some vaccines. You call them within 30 minutes. You have it. You have you want to give a certain medication, but you have depleted your stock. Maybe medical staff have not brought it. You just send message to them, and within 30-40 minutes, the drone will be here, and you're okay.
To Ben Mieza, with the drone services, the future of healthcare delivery in rural Ghana looks promising.
We have a bright future with this drone system, and it has removed a lot of time wasting, a lot of breakages, and it's exciting. It's exciting because you just sit, just type to them, and sometimes they are customer care too. When you think that they are delaying, when you call them, immediately you call, they pick it and they inform you that this, and they are on point. When they tell you it will land on 10:30, you have your vaccine. So we have a brighter future with this drone system in the health sector.
For Mieza, whoever brought the idea must be praised.
Anybody who brought it, the person who thought of it, has done very good thing to us. Yes.
From the Ghana Health Service, led by the Director General, Dr. Insia Sari, then the Chief Director of the Ministry of Health, Sir J. Mensah, and various committees that have worked hard Parliamentary Subcommittee on Health, all have worked so hard and remain focused and dedicated in ensuring that the use of this important technology is now part of the health delivery architecture of our country.
Jantuakrom may be a remote farming community, but thanks to the dedication of the CHIPS compound staff and the innovative solution of Zipline and the government, the people of this community are able to live healthier and more connected lives. From Jantuakrom, for Joy News, I am Samuel Kojo Brace.
And that is the brief bit we've got from Samuel Kojo Brace, my colleague, who was in Jantuakrom in the Amenfi Central area of the Western region. So we're making some strides in that regard. The CHIPS compounds bereft with problems, but at least this is some light at the end of the tunnel. Once more joining me for the conversation, Dr. Fred Adomako-Boateng. We also have Dr. Osei Kufuor-Afre. Dr. Afre, can you hear me now? Right. So let me get to Dr. Fred Adomako-Boateng. First of all, looking at our CHIPS compounds, I'm sure you have some of them in your region as well. What would you say is the state of these health posts?
So thank you, and happy post-Easter to cherished audience. So I just want to take you through to the health system for Ghana Health Service so that people will really have an idea when we talk about the necessity of e-service. So the base for Ghana Health Service is what we call the CHIPS. So I can start. We have the Regional Health Directorate. From the Regional Health Directorate, we go to the District Health Directorate. From the district, we go to the sub-districts. And within the sub-districts, we have the communities. And so in the communities, that's where we have the zones. And in the zones, you are supposed to have CHIPS compound for each zone. So that is the unit or the fulcrum for service delivery. So when we come to Bono East, for instance, we have 285 CHIPS compounds. And these are scattered across 11 districts that we have. And by virtue of the services that the CHIPS compounds are supposed to offer, it behoves that we have some medicines or they don't. So most of the CHIPS compounds that we have deliver basic services. So some of the CHIPS compounds also have midwives. Some do not have midwives. And so by their design, the nature of services that they deliver really will determine the kind of medicines and other things that they will have to have in there. And so from the sub-district, from the community, then you go to the sub-district, the health centers, where the CHIPS compound will also refer to. So I think I would say that scattered across the country are what we call the CHIPS compound, and they are in league with the community that we serve. So that is the state of the compounds that we have. In terms of the service that they are supposed to deliver, it's minor services that they deliver. So minor injuries, minor illnesses that they are supposed to attend to. Some, if they are having midwives, then they would offer delivery services. But if you still don't have midwives attached to the CHIPS, which we call CHIPS with midwives, though when pregnant women come to you, you won't say that, look, I don't have a midwife when they come in labor, so I'm not going to. You have to do what you are supposed to do before maybe you refer. And for instance, when you are in a CHIPS compound and let's say a pregnant woman has delivered in the house, come to you, and the most basic equipment need for the woman is blood. You can't say, oh, as for me, I am a CHIPS compound, I don't store blood, so I'm not going to give you blood, so I'll refer. I want to put the conversation in context. For instance, I'm not supposed to manage people who are bitten by snakes. And the most important medicine that you need to address that is what we call the anti-snake venom. They don't store, but the fact that you don't store them will not say that because you are a CHIPS compound, somebody has been bitten, and the most important medication that will save the person is anti-snake venom. You don't have, so you are referring. So we can go on and on. and for us to see the fact that you are not offering the services by virtue of design do not preclude or do not prevent people coming to your facility with that illness, because they don't know what you offer and what you don't offer. And they know you are a hospital, whether you like it or not. When people come to the CHIPS compound, they say you are a health facility and you are supposed to deliver some services. And then so you see who then will mine the CHIPS compound as we are discussing.
Right.
They are what we call the CHIPS community health officers or community health nurses or enrolled nurses or midwives. And by basic the training that they are supposed to give, will also even determine the kind of services that they provide, the kind of medicines and non-medicines that they store in the facility. So by design, it's no fault of them that some basic medicines that they are supposed to have, they don't. And then when it comes to delivering the services, it's no fault of theirs that the services that they are supposed to offer to save people, they don't have. But then, when it comes to care, the most crucial aspect of care is emergency services, where the interim management of you can prolong your life. If within about 5 minutes, 3 minutes, the basic care that you need, example, blood, and you are not offered the blood, and we transport you from even wherever you are to Kolegu, Konfanoche, or Mayo Clinic in the States. Because we missed that opportunity, there is no way we can do much for you. And I think during the interaction with the guy, with the health officer from Jantuakrom, he said oxytocin. Oxytocin is the most crucial medicine that you need when women are bleeding. And by virtue of the design for most of our CHIPS compounds, where they cannot store because of the temperature requirements, look, when the woman needs that medicine, the life-saving medicine, and you don't have, that is a challenge. And one of them also, yesterday, when I was supposed to have this meeting with you, I made all my district directors send me some of the medicines that are supplied by Zipline, and I said, wow. Look, from where we are at Kintampo to some of Sene East, for instance, I will give Jantuakrom, is about 4 hours. And from Jantuakrom, which is a sub-district, to some of the CHIPS compound, you have to be on Volta Lake for about 3 hours to get there. And if you have a woman who has delivered and is bleeding, or if you have somebody who has been bitten by a snake, a dangerous one, of course, and this person needs anti-snake venom. This pregnant woman needs oxytocin. This pregnant woman needs what we call misoprostol, what we call cytotec, for just insertion to stop the bleeding, and you don't have. And you see how frustrated you will be. So you in terms of life-saving, I mean, if somebody will need paracetamol, and you can't get the drug paracetamol for that person, and it's not emergency, you can tell me the patient can wait, but not in this instance, where what will save the woman is what? Blood. And yesterday, I had an interaction with one of your 7 o'clock news, and I was telling them, look, at times it's not only the blood that you need. There are specialized form of blood products that you will need, that we call fresh frozen plasma, FFP. That will save the woman. And you don't have it. What are you going to do? And so you see that the discussions that we are having now means that some medicines are very important, but you don't need to stock them, because if you do stock them, what will happen is that they will start. Okay, so you need some quantities that will be located at a vintage point, so that when there is a need for us to have, and you can have it. And by way of the way we do things, we can distribute drugs based on the district. Ashanti 43, Blue is 11, I have 6. But you need that, maybe you give more to Ashanti 43, but at the time of need, it's maybe a half, which is having only 6 districts that we need. And would you imagine the transport, the journey, the distance, that because of where we distributed the drugs, we are going to lose precious lives. So in the context of what we offer services, you see that we need some interventions across board. So these are some of the things that these facilities provide for some of us. Because look, there is no point stocking a lot of anti-snake venom in Blue East. We can stock and say, okay, looking at the demand, the quantification, you need about 5 for want of better words. What about in the season that you get about 10 or 20, that you need 20 anti-snake venom? What do you fall on?
Yeah.
So these are in the context for me. It comes in handy and it solves a lot of problems for us. And I will give one typical example. For example, if a woman is bleeding and you need blood for this woman, you have to do some process. You have to do some investigation. Take the blood, do cross matching, see which blood that you need. But at that crucial time, you don't have that luxury. The best option that you can do is give this woman O negative blood, the universal blood, it goes for everybody. And where are you going to get that? It's difficult to get this blood type across the country. Have few. So then, if you have a vintage point where we can all fall on in the whole country, then you need to see how you can save life. You know you need blood group O negative. Where are you going to get some? Where I used to work at Doma Intro in the Dambuhafo region, we in the community we knew people who were O positive, O negative. So that when there was emergency, we went for them in the community and brought them and begged them to give. But,
Wow.
you know, these are all time wasting. If you really, so they are handy. We have their names everywhere in the community. Those who are blood.
Wow.
Yes, of course, you need it. So that at any point, you just fall on them. But what about you go and Ben is going to Accra, and it's not in normal.
You know, right? Because I actually fall into that category.
Hey, then you will come for
if I were in your area, you would recruit me.
Yeah, I'll tell Dr. Charity to come for a great act so that they will locate you, so that they will need you. I mean, these are some of the innovations that you do. So you can see when we have these interventions, how happy we are. We can go on and on. I have the list of the drugs that all my district directors have provided for me by way of these services. They are priceless. You can't really quantify them when there is a need for you to have them. And so, for example, as we said, look, you can give a woman blood, but there is a certain limit by which you can give what we call whole blood. At some point, you don't work. Or even plasma expanders. At some point, you don't work. At some point, what you need is specific, fresh, frozen plasma. And we have it across the country. How many facilities do have it? It's the major facilities like Kolebu, Komfanoche, and then the National Blood Bank that will be able to provide these at just a split second. But for us, we will need it there for us. And even if you have transport, these cases that I've discussed, some of them, Accra Town, is an island community in Sene East, where you will give this woman blood. You have to transport this woman across to Jantuakrom, then to Jantuakrom Health Center. Then you have to transport this woman towards Sene Amidanso Hospital, where there are doctors who can attend to. If you have your blood on this woman, you will save this woman. 3 hours, 2 hours, it gets to the facility, this woman is taken care of. If somebody has been bitten by a snake, we have 2 types of problems that they can have. Either it will affect the nerves or it will affect the blood vessels that they bleed. You have the anti-snake, you give it to them, you transport this person to wherever the person is going, and the person will be taken care of. This woman is bleeding, you have your oxytocin, you have misoprostol, which is given to you, you give, you insert, and this woman is transported. So in terms of service delivery, an emergency service delivery, and I always say, look, the test of your health system is how you're able to manage and deliver emergency services, because that is crucial, and that is the life-saving time that you can really do something about it. That is the test of your services. And the other test of your services, your maternal mortality ratio and rate, how well your mothers after delivery are able to come out alive. That is your test. How come robust your health facility? And these are the things that really support due in dealing with them. So you notice that for a long time in Ghana, the leading cause of deaths were what we call blood, postpartum hemorrhage. Now it's overtaken by tension. For us, in Gnus, the last one, 2021, the leading one actually is still bleeding. Though there are some causes of mismanagement that would then lead to this kind of misbleeding. But be as it may, if you really have blood, that is what life-saving that. So that is what I would say, that in terms of the context and structure, we have chips. The chips is the lowest. They have some services that they can deliver. They have some services that they cannot deliver. And though they have services they can deliver or they cannot deliver, sickness, we don't know that. So at any point in time, they will come.
So walk us through a few of them. What they are the very bottom. They are like the places you would go to as a first port of call. But what services do they deliver? What services don't they deliver? It's also important we put that out there so that people know and realize maybe that if you have a certain category of illness, or maybe if something specific is happening to you, that may not be the first place to go to, unless maybe it's an emergency. Just give us a fair idea what the dynamics are.
Okay, so thank you. So we have the CHIPS. Who are those who are at the CHIPS compounds or the CHIPS zones? They are what we call community health officers. And basically, these are the caliber that we need, community health officers. Who are these community health officers? They are either community health nurses, community enrolled nurses who have been given specialized training, at least 2 weeks. Now we have some abridged forms where they are classified as community health officers. What do they do? So some of the CHIPS compound, you can also have midwives. And so some nowadays, we call it CHIPS Plus. And that we have some maternity attached where we do ANCs and delivery. What do they do? Mainly, their activities are preventive in nature. And when we say preventive, so typically speaking, by design, they are not clinics. Like you go to a hospital, when you are sick, you go to a hospital, you wait for a doctor or a pharmacist or a nurse to know. By design, they are not supposed to be.
I like the way you say by design, because the plan is one thing and the actual is another thing, isn't it?
I agree with you, Eben. I agree with you. But you know, and that is where the education should come for all of us. Because some of us will say, what do you mean it's not creative, it's not clinical? We associate any care with somebody is sick and is taking care of and giving medicines. It's more of preventive nature, more than curative measure. And when we say preventive measure, what are they supposed to do? You know, the CHIPS are supposed to, that zone, they are supposed to enumerate almost all pregnant women, all children under 5 within that community. And they are supposed to have a register. And when they have that register, what they are supposed to do is that every child who is supposed to be vaccinated is vaccinated. 1. Every pregnant woman is captured, and that pregnant woman is going for her ANC. If they are not going for ANC, it behoves on this officer to make sure to find out why they are not going. And then what do? They also make sure that people who have defaulted in medicines, they go for TB drugs, they didn't go, they are alerted and they go. So that is the basic design that they do. And they also go to what we call outreach services. So in the communities where they are, they have some points where they go, and then people will come like CWC, Child Welfare Clinic, to bring your children, they immunize them. And because they have registered them, they will know every child has been vaccinated. It's a brilliant concept. And all of us will be captured when we are able to implement it. Any delivery in the community is supposed to be captured by the community officer. Every death within the community is supposed to be captured by the community health officer. So they have days that some particular time, every house within a catchment area should be visited by these CHIPS community health officer. So that is the basic design. And so they do what we call home visits also. They visit homes where they look at community, and they are able to look at the community, a kind of sanitation. They're able to diagnose the problems that are supposed to come within the community by virtue of maybe the behavior practices in that community. So that is what we mean. It's more preventive, and that is the design. Notwithstanding, when they are in their facility and somebody comes with minor illness, there is a small cut on your hand. They should be able to manage that. When you come with fever and able to look at, look, this fever is not a severe one. It's a basic, normal, what we call uncomplicated malaria. They have medicines that they are supposed to treat. So these are the design by which, if you default, and as those with the midwives, if you come, you can have your ANC there, and in that particular ANC, you're able to notice that this A kind of pregnancy is a high risk one. Has no business. The midwife has no business attending to that high risk pregnancy within the community.
Right.
He's supposed to refer to what? A higher.
Right.
So by this, and if they're able to do this very well, they're able to pick all high risk pregnancies there. And by design, and if they are able to work very well, they'll be able even to pick some of the pregnant women who are living offshore, island communities. During their expected dates, they come and stay there. So that's another concept, pregnancy school, they should be able to do that. And then you bring it for them, and they are able to make sure that you deliver with it. So in the concept of the community chips, that is what the fathers were thinking about. And so if you look at most of the problems that we are discussing, many of them are preventive. For example, somebody who had 2 previous cesarean sections, you have no business going to the chips to deliver. In fact, you have no business going to a health center to deliver. But then if you don't really go out and look for them, how do you get them?
Right.
So that is the design.
So there's an education or an educational deficit there as well. Because some cases that go to the CHIPS compounds shouldn't even be there, but people simply do not know. And it may also be about access. This is closer to me, but a hospital facility is many miles or kilometers away. So I would rather go here.
Yes. So the concept in the implementation of the CHIPS concept is more of a community involvement thing. If we are able to go through the processes very well, we have about what we call 6 milestones and 13 implementation steps. And these are thorough.
Right.
That if we are able to go through all these milestones, and under the milestones, we have the implementation steps. That even in the formation and in the functionality of these CHIPS compounds, we have what we call Community Health Management Committee, who are really drawn from the community. And they are supposed to support the community health officer in delivering the services. Their roles and responsibilities are some of these things that we are discussing. The ability for us to really educate the community, for us to know the CHIPS compounds can do what it cannot do. All of us will come to that agreement that, look, when it comes to this and that, this is beyond the compound. And so in some communities, we have what we call community emergency transport system. It's beautiful. Where the community came up with some transport, some form of abubuya, and it's more different from abubuya kind of pragia, where they have added some facility to that so that they will be able to transport these pregnant women. And I think one of these is, and I will invite you to Ebnois, and then I'll take you to...
Please do. I would love that.
So that I will take you step by step. Every quarter, these community health management committee members, we are not able to sing the good things that we do too much as Ghanaians. in the kind of good things that we do, we have been trained like that. Where the community themselves are going to enforce that, look, this kind of problem, you can't go to this area. It's more of a community ownership involvement thing more than the health system. We will healthcare, we will deliver the care, the services, but the support is from the community. And this community health management committee is so pivotal and crucial in the delivery of services. You know that even it's a community health management committee, which is supposed to provide security for the CHIPS compound. I mean, look, go to Upper West, go to Upper East. It's so beautiful. Where they even do farming for the community health officer, they paint, they provide the basic care. All that you do as a healthcare officer is to deliver the care that you have been trained for. So that is the concept for the CHIPS compound. So from the CHIPS...
Go ahead. Wrap on that point before I come in.
So from the CHIPS, the next point of referral is what we call the health center. And that is the missing gap in the Ghana health service. Every time we will have discussion about. So you have a number of CHIPS compounds, and then the number of CHIPS compounds is served by a health center, which is a sub-district. But what actually has happened with some time is that most of the CHIPS centers have been developed so much to the detriment of the health centers. And I think that is the vision of the Director General Ghana Health Service, Ministry of Health. And I think at the appropriate time, we'll talk about what we call network of practice with a model health center, which is actually trying to boost and give these referral systems, and then some of these problems that we are discussing will be addressed. Because what is happening is that this middle point, there is a missing gap, so that health centers straight away refer to clinics, and the gatekeeper system of the health center is challenged. And I think at appropriate time, we will discuss this. So in context, you see the reason why some of these services that we are having is so important that by design, this facility is not supposed to provide these services.
Right.
That do not prevent those problems coming. So when these problems come, we should have an interim measure to support them before others are done.
A two-pronged question. Let me find out from you. How about the coverage of these drone services? Are they up to scratch? Are they what we would have them be? Is there more that can be done? We've heard the Vice President talk about the fact that it's the largest drone delivery service in the world. But the coverage, is it what we expect? Can more be done? And are there other things, like I said, that ought to be done to ensure the effectiveness of these drone delivery services? What would be your response to that?
Ben, there is more to be done.
Your response would be?
There is more to be done.
Right.
By the discussions that we just had, we have over 1,000 CHIPS compounds. And whether we like it or not, they are providing services. So the best for us is that all these CHIPS compounds are hooked to one form of these Zipline operation centers, as we are discussing. Because whether we like it or not, maybe one day you have never managed a person who has been bitten by a snake, but one day you have. And based on the way we do our quantification and forecasting, look, if for about 5 years I have never gotten any snake bites, why should I put that in the budget and request? I mean, naturally, you don't do that. But you never know when you have that problem. And you are saying that, look, I don't take care of deliveries. When people are due for deliveries, they'll go to maybe Basa. Basa is one of the sub-district health centers in Senate. You say, I don't. No, you wait to have somebody who has delivered in the house and come to you. So by virtue of the services we provide, whether you like it or not, if you are providing a self-service, you have to be mapped or to be hooked to one of these. And they have not done. So they have to be supported to be able to do that. I mean, for example, if we employees are trying to still extend, they are trying to have the places where they do this. We have our services from Karachi, the one at the Karachi.
Yeah.
Apply that far east. and the one at Mampong, Supply, then Kranza, those areas zone. So, and I think if you talk to, if Dr. Frey or say before will come and the other Western North will come, see, we have a lot of these hard to reach areas. You come to Bunis and I'll tell you that when we say Bunis, we are talking about
some of these are even island communities, island areas, islands.
Yes. So definitely, we have done all the mapping, but they have to be supported so that all these, and you see that it's very cost effective. Very cost effective. Rather than giving 10 anti-snake to Bono East, 10 to Bono, 10 to what? I have for 30. And at the end of the day, I will use one. But these are emergency drugs that you need them anyway. You get the point. You need them. You don't say that because because emergency will never announce. So why spread it so 10, 30, 10, 10, rather than even having, let's say, 10 at an area where this 10 can be effectively used is the discussion. That's what we are talking about. And saying that, look, people will come and deliver. So I will need about 20 ampoules of, let's say, oxytocin in Bono East, 20 in Bono, 20 and a half for 60. And at the end, I will use about 15.
So the apportioning in that sense, do you think we're getting it right?
Yeah, so we have the minimum emergency drugs that you have to stock, whether you like it or not.
Right.
It's a basic minimum that you need. But the fact that you have stocked them doesn't mean you use them. And that's the discussion that we are having. So rather than stocking them in Bono East, Bono Ahafo, can we have a central location? And by means of central location, the delivery time should be so effective. So that if I need this...
That is using the drones.
The drones, that is the point. Any means by which I can get it within some time. Even the bleeding that we are discussing, when women have delivered and are bleeding, and you delay for some time without giving them blood, they enter into what we call disseminated intravascular coagulation. Whatever you do, it's late. Do you understand? So it means that not only having the medicines when the medicine, but the time.
Right.
The time is also very important. So you will have to deliver it within some period. And that's what we are discussing, that then other interventions then will come in play. So that one, you have the minimum stock for maybe even a central zone. You have the mini stock for the southern zone. You have a mini stock for the northern zone. And you can even have a mini stock for the coastal zone.
Right.
And these are when you need them. And it will surprise you that it will come to a period. Only one of maybe the regions will consume all the stock. The beauty of these kind of services that. So you see that it's very resource optimization. Is key.
And that's an interesting point you make. And maybe as you say it today, and as your health directors and others, I mean, those at the national level also listen to you. I don't know whether there are some conversations that you have started or that have been had in medical circles in that regard, but maybe that is something that we should be looking at moving forward. But in the instance of Jantuakrom, okay, it's a very remote community. Their road network is terrible. If someone had an emergency there, what would you suggest they do?
This is a big one. What do we do? It's based on the kind of emergency that we are having. And the emergencies, we will list them. Ghana Health Service did a work in Amasia West. That is when we are trying to build the telemedicine, where they had a teleconsultation center. And this is also linked to the Jantuakrom issue. Look at the remoteness and how this area is so far from expert service delivery. With a phone call, telemedicine, when you even call, the kind of service to deliver, as we said, the nature of training, these people will not be able to deliver that service, isn't it? So when they call, what do? Let me give you a typical example of this. Hypoglycemia. When your sugar levels are so low. And the basic thing that you can do then is to test this and know that the sugar is low. Even if you don't have any medicine, the best thing you can do, if you have any sugar, you can put it in the mouth. Even Fanta, you can get for this person to drink. If you cannot even test, and by nature of where you are, you don't have a step to test. What do you do? And these are some of the things that come in. You don't need light. If you have these strips flown to you, you can quickly do it. Not only that, by the time it's coming, because you know you have spoken to somebody, he can tell you this can either be hypoglycemia or hyperglycemia, low sugar or too much. If you are not so trained, you are not trained very well, at the times of the clinical presentation, will be able to kind of smell and other things, will be able to know whether it's too much sugar, too low sugar.
Right.
You're not able to do that. That when you talk to somebody, the person can even add the two interventions. He can add sugar, what we call 5%, 10%, or 50%, or he can add normal saline or Ringer's lactate. In any case, it can solve this problem. It can happen to any of us. Maybe you know the Easter, how many people went for binge. Instead, their celebration price is crazy.
Right.
They went to buy bottles. And this person is sleeping. There is not, you touch, the wife touch or husband touch, it's not. You rush to this person. These are the services that can be provided, apart from the logistics and cost and all this. So the fact that the person is in Jantuakrom, in Accra town, in a place, you have a similar places like Jantuakrom, where you have to drive by the fiber boots for about 2-3 hours to get there. Yes, the persons shouldn't be denying services. They have to be taught. They have to communicate. They have to tell us, and we have to tell them what to do. This, the ZIP can do it. Any interventions tailored by this nature can do it.
Right.
And this is important because when you do that, can you imagine, look, when I was a house officer, help me to just allow me to do that. And the first case I got, this person came with hypoglycemia, we checked. And I gave this person the truth, and the person came. Then I believe myself that, wow, I'm a doctor. So these are some of the nice things that you can do that can bring people back to life. You see, it's not expensive. It's not too expensive.
Interesting.
But where people are, they are going to die. And this is not good. Look, if you are talking about universal health coverage, health for all by 2030, these are some of the interventions all of us should come together to make sure that we are strengthened, if also all of us.
It's been really refreshing having this conversation with you, Fred, because the number of matters we've brought up, and like I said, that point you were making about, the centralization, if you like, of stock, because you may put 40 here where 40 parcels of some of these medications or drugs or even vaccines may not be needed, or anti-snake bite, potions may not be needed. Yet in other places where they are needed, there may be constraints. And that is why in harnessing these drone delivery services, we ought to look at how we can centralize. I agree with you, and how we can make the system better. But this is a conversation that we're going to have ample opportunity in the future to talk about. In fact, I am paying a visit to one of their points, their delivery points, or is it departure points in the coming week. So there's a lot that I'm going to be doing from there as well.
2 or 3 days. 2 or 3 days count. Let me take you through how we deliver services in some of these areas. Come and get first-hand experience. I will take you from the regional health directorate. I'll take you to a district.
So let's do this. Next week, I'm going to one of those communities, but in fact, with Zipline, but sometime in May, after I'm done with my exams, I will take you up on that. So let's plan for May, somewhere in May.
Do that.
And
do that.
I'll come over so we get to know what exactly is happening.
Let's do that.
Dr. Fred Adomaku-Boateng, Bono East Director of Health. Thank you so much, sir, for joining the conversation. And that is it. But before we take a breather, before I take a break, we know water is life, and the best we can give you, Awake, which is premium purified water treated through a strict purification process to ensure that every one of those bottles you're buying on the market refreshes you better. And in terms of size, the kids, when they're going, you can give them 330 ml, potable, portable, and it can be in their kiddie bags. If you want the 500 ml bottles, you can get those as well, 750 ml, and 1.5 liters for the heavy drinkers. So all you need to do now is stay awake while drinking Awake Purified Drinking Water, wherever you go. Now choose a bottle of Awake Purified Drinking Water, and here is an add-on. Here is why. For every bottle you purchase, an amount is donated to the National Cardiothoracic Center. So each time you make a purchase, that's a donation you are making with your money to the National Cardiothoracic Center, so that people with heart issues who can't foot the bills can get some assistance. Isn't that heartwarming? It's another product of Casapreco Company Limited. If you mean to purchase in bulk, this is the number to call: 0262 351 251. 0262 351 251. This advert is FDA approved, and I believe my thirst is also FDA approved. I'm going to take a sip of water. I'll be back after the break.